Doctor, one of the things you mentioned is how oral health can affect the whole body. I think a lot of people think that if there's a problem here, it's confined to this area. But can you describe how that is the case, where it can
well,
affect
just
everything?
looking from a traditional dental standpoint, just letting the holistic side go for a moment. The traditional model is, you know, if you have periodontal disease, you have gum disease, you have an increased chance of, you know, heart attack, stroke. And I know I saw this, and I couldn't get back to that website, but I most recently saw where gum disease was a contributing factor to pancreatic cancer. So I thought, okay, now my job's really, really important. I thought, holy cow, you know. So it really, it puts dentists higher, in my opinion, than a medical doctor as a first line of being able to prevent some of these issues that the medical doctors see. Because if we could say, hey, you know, you've got issues here, let's try to address that with nutrition, but, you know, this is where you're going if we don't do this, you know. So you get your doctors ready, because this is where you're going to end up. So I think with so the periodontal point of view, when patients that have had artificial implants of any kind, hips, knees, whatever, pins, plates, anything that's foreign, we are recommended to give them an antibiotic before we do any dental work. Why do you suppose that is?
I don't know.
Yeah, because the organisms in the mouth will enter the bloodstream and potentially find their way to that new body part, and set up house there and cause an infection. Likewise, we pre-medicate people that have faulty valves in their heart, because the strep in the mouth has the affinity for the heart muscle. So we put them on a prophylactic antibiotic. So an hour before the procedure, they take antibiotic, and then we do the work so that the antibiotic's in the system, so that when we're releasing all of these organisms into the system by our work, that they'll be captured and disposed of. So bacterial endocarditis is one of the sequelae of having your teeth cleaned. And so cleaning the mouth before the dentist works on it, I had a patient, and I mean, and shame on me for taking so long to realize the importance, but several years ago I had a patient that said, every time I get my teeth cleaned, I end up in the hospital with pneumonia. And I said, really? And so she started bringing in her own little oral rinse. So then ever since then, I just made that my protocol to have somebody rinse with, and we use iodine in our office, an iodine solution to disinfect the mouth. If they're allergic to iodine, we'll use something else, tea tree or oregano oil or something. But so just kind of over time, just realizing the connection between the mouth and the body. And furthermore, if you've got you know, gum disease, then, you know, they're doing C-reactive protein, so chronic inflammation. If you've got chronic inflammation in your mouth, it's throughout your whole body. So you're setting yourself up. So it's actually kind of like, you know, I remember my professor saying, you know, I wish God would have put a zipper, my anatomy professor, you know, a zipper here so that we could see. And, you know, here I'm like, duh, you know, it's right here, you know, and I see it every day since I'm 16 years old. I've done nothing but look in mouths. And I'm like, oh my gosh, you know, so much more is coming to light, you know. And then the other things are, so there's a lot of doctors starting to test now, a dentist starting to test for C-reactive protein. So they can better help, and diabetes can be seen as you know, bleeding gums and such. So, you know, we can then alert the practitioners, alert the patient, and then go to their practitioner to see if they need any help.